Right.
So there's March 28th, we're back in Senate Judiciary. Speaking with DCF, follow-up of H2, which just to verify we've already passed out of here and passed out of the Senate. And it's presumably where it needs to be now. So we have Commissioner Winters on the list.
Thank you, Senator. Good morning, everyone. Appreciate the time this morning. For the record, my name is Chris Winters. I'm the Commissioner of the Department for Children and Families, and really do appreciate the opportunity to come in and speak to some things that you all heard last Friday, about a week ago, in terms of raise the age when you were taking testimony on H2. And we wanted to present a fuller picture, I think, of things that are happening. You heard some things that were very concerning. I'm not here to say to doubt the veracity of any of those things that were said to you, but to give you an update on what has been happening over the last year in terms of our high-end system of care and our efforts toward recruitment and retention of our workforce. There's a lot of positive things that have been happening that weren't brought out in the testimony last week. We don't question the veracity of that testimony. I think that was the true experience of family service workers on the ground, particularly in 2022, 2023, into 2024. There are some things that we're doing that really helped us start to turn the corner. I think if you ask some of those family service workers today what their experience is, it is looking different than it has been. So we are making progress. And I have some folks here today with me who can help speak to that progress and answer any questions that you might have. In the room, the Deputy Commissioner, Erica Radke, who's not scheduled to testify, but is here to answer any questions you might have. Folks who are testifying today, we have Alma Alvarado online. Alma is our Workforce Director. It's a position, her position was created in late 2023, so really focused on the Family Services Division workforce. We've always had a Workforce Director in the Commissioner's office for the full department, but Alma really focused on family services, and she can speak to all the efforts that we're making there that are really starting to make a difference. We also have Tyler Allen, who is our Director of the High-End System of Care. Tyler's been, his position was changed a bit to really focus on that high-end system. That's some of the things you heard about on Friday, was not having that system of care in place. Needs if family service workers have to do staffings in alternate locations in addition to their duties, putting them in a bad situation, putting the kids in our care in a bad situation. And that's what we've been working on correcting over the last couple of years. A lot of this progress has been detailed in those reports every other month that we've been providing. We have another one that's due in a couple of days, the final one. The report on raise the age progress, we talk about workforce and we talk about high-end system care in those reports. If you want to say the most, that's the most accurate accounting of what has been happening up to date in the Family Services Division. Several of our high-end system of care and our workforce projects have been successfully implemented in the past year, and some of that's very recent. So the experience of family service workers in 2023 and 2024 was real. It was difficult. It's changing, and we're here to tell you about the ways in which it's changing. We're trending positively for fewer staffings, for more supportive services for youth, and for less staff turnover and fewer vacancies. Those numbers are all moving in the right direction. We hope to keep them going that way. Those are modest improvements, and they've taken a lot of time. And we're still not prepared to serve 19-year-olds. And so we greatly appreciate the time that this committee took on H2 and that you passed it out for the decision to delay for 2 more years while we continue to make those improvements and change our systems and rebuild our workforce. So in terms of workforce vacancies, and you'll hear more about this from Alma, this fiscal year, we've continued trending lower. At the beginning of FY25, we had about 28 vacancies across our Family Service Division and family service workers. And as of now, we have 17. So that's definitely moving in the right direction. Our last available annual turnover rate was 16%, which is high. Other states experience much higher turnover rates. You don't want to see a 16% turnover rate. That's a bad sign. But our current point in time, and this is a very short point in time, the last couple of months, it's been 6% turnover rate. So we've seen that go down. That's not going to stay at 6%. It's obviously going to be higher than that. But it's a positive trend again. Due to under job satisfaction, our last employee engagement survey, which Alma will speak to, showed a 61% staff satisfaction and intent to remain in child welfare. Again, that's a low number. We'd love to see that come higher. We don't have our 2025 scores yet. And then just anecdotally, we're doing visits to district offices showing some increased job satisfaction, increasing confidence in our high-end system of care resources. We do labor management committee meetings frequently. I think they're scheduled for every month. Sometimes we miss one or two, so it's every couple of months we meet with labor. And we have DHR there. Erica and I attend those along with other family services leadership. We talk about some of the challenges that we face. Those meetings we've aired some really difficult conversations. Those meetings are getting better. We've been listening over the last 2 years. The challenges that our staff are facing, we're trying to fix it. Those labor management committees also meets with me, the Deputy Secretary of Human Services, and the Secretary of Administration, Sarah Clark. We've been having regular meetings there to make sure higher up leadership is connected to what's going on the ground with family services. So we're spending a lot of time to make sure we're actually listening and making change. In the last year, and Alma will speak to this as well, we've implemented 22 different strategies to support our workforce satisfaction and retention. This includes a mentoring program, wellness culture, training needs assessment, district visits, and to hear firsthand from staff. She'll go through a few of those in high level in just a few moments. And on the high-end system of care, this is where we've really started to turn the corner. There's new programming that we've developed to support youth with those really high needs to keep our family service workers from having to staff them in those alternate settings. The Red Clover Treatment Center in Middlesex went online in October. It serves 4 youth. Those are youth who, in many instances, would have had to have been staffed by family service workers. So that's made a real difference. That happened in October. In January, DCF partnered with the Department of Disabilities, Aging, and Independent Living to develop our first ever youth-specific crisis intervention network bed. So we have a bed in, I'm blanking, Brookfield, to house an individual youth with complex needs, who needs, extreme circumstances, might need medical care. Again, that was one of the youth that we were asking our family services workers to staff. Really, they don't have the skill set to do things like that. So that's relieved a lot of pressure by having that one bed available there. And we've expanded some of our residential and crisis stabilization programs, gradually expanding them. We have what's called the CATS team, the Child and Adolescent Transitional Team. Those are a group of volunteers we trained up to do those staffing. So these are people who want to do those staffings. They get paid time and a half to do it. So instead of asking family service workers to do that, we've got this group of volunteers who are deployed. And we've expanded our contracts with some traveling nursing staff. It's TLC is the vendor's name. They'd be great. We have several nurses now who will help do those staffings when we have youth with really complex medical needs. We wouldn't want to ask our family service workers to staff. So all of those things together have really dropped. So the CATS scheme went into effect in December. So Red Clover in October, the CATS scheme in December, the BCIN bed, Dale bed in January, beefing up our contracting with TLC nurses and also recruitment of extra respite providers to do those staffings have all led to a dramatic decrease over the last couple of months. So it's going to be something recent that maybe not all our family service workers are feeling yet or maybe trusting yet, given the last couple of years of staffings that they've asked them to do. But it's all getting much better. In a recent labor management committee meeting, We had folks remark that it finally feels like things are getting better. I think you heard that from Tracy Casanova in her testimony on Friday, that she's seeing things change, that things are getting a little bit better. But it's understandable that after a couple of years of being asked to be put in those really difficult decisions, that the staff are still reeling from that and maybe not trusting that it's happening yet. So that's the purpose of me coming here today and bringing some of our folks here today, is to let you all know that we have been working hard on this, are making progress. That progress takes time. And it really feels like we've turned the corner. Questions on that, or can I turn it over to our workforce folks?
Senator Morse.
Yeah, I'd like to commend you on the efforts you're making here. So if you had to put your finger, in your opinion, Commissioner, on one particular item as we move forward with July 1, 2027 date, is it staffing and resources, facilities, or all of the above? What's going to get us there?
Staffing is really important. So the caseloads that we have, we're seeing the number of youth in DCF custody trending downward as well, which is a really good thing. We still have these vacancies. Even if you gave us more positions, we're not able to fill these vacancies. So we'll talk about our efforts there. We're making progress. We've had more applicants than ever in the last couple of months. We're really seeing things change in the way that we're approaching it. So staffing is huge in caseloads. We're not taking on additional work until we can handle the work that we have. Another piece of this is facilities. We have these 4 beds at Clover, but we need more than that in our secure facilities. So we're continuing to work on the Green Mountain Youth Campus in Virgins, which is at a bit of a standstill at the moment. So we don't know exactly when that could come online. But we're having a meeting with Virgins again soon. Those 2 things are, I think, the major roadblocks, as well as the systems. So CWIS, the Child Welfare Information System, just having that backdrop of the data system and the IT to manage different age groups. That's out to RFP right now. So really way to predict how long that will take to implement. I can say those are the 3 major things of I think there were 5 that we raised a couple of years ago and asked you for a delay. Progress on all, but not really enough progress.
Any additional questions? Great, thank you, Commissioner. And feel free to pass it off to whomever you're.
Alma and Tyler, I know you have a presentation. I should say we're also joined by Lisa Trimboli, who is our high-end system of care coordinator, works with Tyler on all things high-end system of care. I'll turn it over to the 3 of you to go ahead and make your presentation. Thank you.
Thank you so much, Commissioner. For the record, my name is Tyler Allen. I'm the High-End System of Care Director for the Family Services Division. And primarily, Alma and I will go through, I think, Alma, you'll start us off on this this presentation, and we're just going to go into a little bit more detail as to what the Commissioner already shared with the committee. And we'll have some graphics also that you can see. Sometimes a visual representation helps. I would like to invite the committee to, of course, pause us at any time if you want some more detailed information about what's happening. And while Lisa Trimboli is not on our presentation here, we've asked her to join us because she's really on the ground with this work. She works very closely with the district staff who are managing the most difficult caseloads at any given time, and she helps with organizing alternative setting staffing patterns, and she's involved in all the kind of crisis huddles. So she has a real good bead on what the workforce is experiencing moment to moment at the kind of point of highest crisis. And so she might be able to provide some insight as we go through if you have more targeted questions. I'd like to turn it over to you, Alma, to start us off.
Sure. Hi, everyone. I'm Alma Alvarado. I'm the Workforce Director, Development Director for Family Services. And as you heard, I've been in my role a little over a year. And before that, I was in the districts working for about 11 years as a family service worker and as a family service supervisor. So this is all very close and near dear to my heart. Is it projecting okay?
Yeah.
Great. Okay. So I just wanted to start off with our vacancies. Chris shared a little bit about this, but this graph shows how many vacant districts family service worker positions we've had at multiple points in time over the fiscal year. And at this time, we have a 10.6 point in time vacancy rate, and our goal is to reach an 8% annual rate. So I'll share a bit more about our workforce goals ahead. But this fiscal year, as you can see here, we've continued trending toward lower vacancies based on multiple strategies we're using for recruitment and retention that have changed. At the beginning of fiscal year 25, we had 28 vacancies and we currently have 18. I know Chris said 17 because in a few days we're going to be back down to 17. And so since our highest vacancy numbers in the beginning of the fiscal year, we've been utilizing new recruitment strategies that include investing in sponsored postings, updating our social media efforts, and updating how FSD can be found via job searches online. So we've also implemented retention strategies related to vacancies, such as reclassifying family service worker positions and for positions that we had a hard time filling in order to convert them to other positions that will still help to lower family service worker duties and provide additional support to the districts in new ways. So during this period on this graph, we actually reclassified 7 positions, and some of those were FSW positions. And based on that, we were able to create additional resource coordinator positions, senior family service worker positions, increasing the ability of our districts to support our placements and leadership capacity there. And in addition, we created a position that has been responsive to staff requests to have a more intensive or proactive approach in communicating with the public about our role and about our successes when able to improve our community relationships and collaboration. So to do that, we're recruiting for a family service worker, a family service division director of communications and legislative affairs. And last, I wanted to share that we experience concentrated numbers of vacancies related to critical role turnover and subsequent worker turnover cascades. So what that means is that generally we see vacancies clustered around specific districts. And right now that is within the most of our vacancies rest within 3 major districts. Our job satisfaction and caseloads, we're looking at that through our employee engagement surveys. We last conducted ours before the implementation of CATS and the other HESOC resource increases that Chris was talking about. And it showed that 61% of our staff who participated endorsed feeling general job satisfaction. And so of course we want to move that up. Staff safety survey results from 2024 also show that 61% of staff had an intent to remain in this work. And we did rerun that survey, but we don't have results for 2025 quite yet. And in late 2024, FSD reclassified district family service workers into a higher pay grade from a 24 to a 25. And at this time, the family service worker class was divided into 3 classes, the district family service workers and residential licensing family service workers, and then separately the central intake and emergency service workers to better reflect that there's a big range of work that they're doing and high stakes interactions they're engaging with directly with families that are different for each role. So those changes have not been completely updated due to additional review by DHR that was needed. But this has now been resolved and therefore we can implement those changes and hopefully see a positive pay increase that will support retention for workers. In terms of average caseloads, the number of families per ongoing worker, if all positions were filled, is 10 families per worker. However, when adjusted for vacancies and workers in original probation, which limits their ability to take cases, this number is 13 families per worker. So we are currently still working on meeting the best practice standard of 12 families per ongoing worker. And in the last year, we did see caseloads have decreased per worker. Though we know that the complexity of these cases and the time-intensive needs of each case have increased over this time. So we recognize this number does not reflect, it's going in the right direction, but it doesn't reflect the societal and community constraints that impact workers' responsibilities, especially given the lack of referral and support services in the community and limited foster resources. So this number does not reflect sibling sets, and we know that may mean added workloads for some workers with sibling sets on their caseloads. And however, the way that we count caseloads have maintained over time consistently, so we can see that trend and that we see that lowering. As to turnover, we all probably know child welfare is a field that experiences notoriously high turnover rates nationally. And as context, the estimated national average turnover rate for child welfare workers is 30%. It actually has been trending up, rising from 25% in 2015. And in Vermont, our last completed annual rate was 16%. Our most updated data from HR shows that we are currently at 6% turnover rate for workers in the family service worker class. And due to the reclassifications I just mentioned, this data does not include any new hire turnover due to the unprocessed reclassification. And as context, Maine, who is similarly situated, has a last annual turnover of 16% as well.
Senator Marcus.
Yes, just out of curiosity, when do you expect to have the 2025 scores on?
What do I expect them to be?
To have the results in the 2025 scores?
I suspect in the next few months, we are actually in the process now of HR is going to be implementing those changes, so everyone will be able to be in the right class, and then those numbers will be rerun. I don't have an exact date. Sorry about that.
Thank you.
Sure. And our 2025 workforce priority goals include focusing on lowering vacancies, including increasing job satisfaction and filling vacancies more quickly while increasing our retention. So as we talked about vacancies, our goal is to decrease to 8%, and we're slowly heading in the right direction as we decrease our vacancies. And our last annual vacancy was 11.4, and in January, our point in time was 11.7, and again, it's trending down to 10.6 now. And as to job satisfaction, our goal is to support gradual increases in our scores as measured by the employee engagement survey, as well as the staff safety survey. And we want to see a rise from 61% job satisfaction and intent to remain in this work to seeing that goal of increasing to at least 65 and going from there. The new staff safety survey, as I said, we have conducted it, and we're going to be reviewing scores soon. Although there continue to be many workforce issues to address, anecdotally, central office visits in districts communicate that we are turning the corner slowly and positively, improving job satisfaction and confidence in the high-end system of care resources that we're developing. Our third goal is to decrease the time it takes to fill our district family service worker positions. And in 2024, our time to fill was 127 days for HR data for the continuous recruitment. And this has remained the same now. And we're working on lowering that. So the time to fill data does not take into account every position number that is filled. What it's accounting for is the calendar day between the first posting and the date of the first hire for the entire requisition or type of applicant because of the continuous nature of our recruiting. So if we fill 2 position numbers and then another vacancy pops up, that's actually added to the same existing child requisition, meaning that that number is not a representation of the individual time to fill for the position, but it does give us an overall measurement that is measured the same way every year. And we're working on an alternate metric. And last, our goal for turnover is to decrease from annual turnover from 16% to 13%, and then working towards 12%, which is the optimal recommendation for turnover in this field. As I noted, currently we're looking at existing FSWs. If we look at existing FSWs without new hire turnover, we have a decrease to 6% for this fiscal year to date.
Well, if I could just jump in there for 1 second, just to, I think, this committee understands that these family service worker positions are some of the hardest jobs in state government. Working directly with families with really complex needs, sometimes putting their own safety on the line. Really emotionally heavy work. It leads to burnout. And you see that in other states. You saw the figure earlier, the 30% turnover rate as an average in most states. So when you look at some of these numbers here, I'm not saying things are great, but just keep that in mind that we are going to have, we're going to have turnover, we're going to have vacancies. We have to do our best to support our workforce so that that is as low as possible. People often come up to me and say, you've got one of the hardest jobs in state government, but I think it's the folks on the front line here who are working directly with these families every day who have some of the hardest jobs and keep on coming back to solve problems for families and help families in the face of really difficult circumstances. They're the folks that deserve the praise here.
Definitely, thank you. And I just wanted to clarify on this slide for goal 3, it does say 127 days averaged and 72 for all roles. I just wanted to clarify that 127 days is specifically for the continuous recruitment for district family service workers. 72 is for all the roles that we recruit for. Okay, so we talked about some of the challenges and the progress we've made, but we're currently implementing 22 strategies to support worker recruitment and retention, and I've highlighted some of the efforts here. In February, I was very excited. We launched a pilot mentoring program to support some new hires because it's a pilot, it's a smaller group, won't be for everybody, but some new hires for high vacancy districts will be supported to onboard and build connections with other employees that are already doing really well. And we have already held 2 mentoring trainings this year. And the feedback has been positive in terms of how this supports the personal leadership development of the mentors. And these participants stated that they felt like it's empowering them to help the helpers, as one mentor put it, in retaining. And we also held our first quarterly all staff. We received positive feedback about that as well. The purpose of this meeting is to support transparency and connection between leadership and our workers, and to provide a time for leadership to be responsive to our staff requests as to what they need to hear from us. And so in that meeting, we provided updates to all the staff, as well as concluded with a celebration naming our first employee of the quarter. And because of the national issue I've talked about of child welfare workforce issues regarding retention, the Quality Improvement Center for Workforce Analytics, it's a project of the Children's Bureau. It's been actually supporting some states to utilize a proven framework to guide workforce strategy selection. And it's focused on improving our workforce outcomes over a period of 2 to 4 years. So Vermont Family Services Division was actually selected to work with this team, a team of experts that will support a process for long-term implementation, evaluation, and data visualization tools to enhance our ability to impact all of these goals that we are trying to work on. And we've been looking at our processes to identify where we have hiring bottlenecks and other systems issues that may impact retention, so that we can adapt and put resources where they would help identify candidates that are no longer interested and support districts to keep candidate pools up to date. And that will impact our time to fill. Over the past year, we've also established workforce partnerships and enhanced our relevance in educational institutions by building a strong hoping to build a strong pipeline of future talent. Our focus remains on creating meaningful value throughout the process by creating a process for informational interviews, so students can ask us about family service work and human services. And so we've set those informational interviews up with some Vermont schools and agencies. As I've spoken about briefly, we have reclassified positions to support needs in the districts and in the central office level to support identified needs and just be creative about our solutions. And based on our concentrated vacancies, I talked about how we have clustered vacancy rates. We are implementing individualized support plans that are responsive to the specific needs of the districts. For example, in one district, we are targeting relationship with staff and building trust and supporting new leadership to do this work via involvement directly from our deputy commissioner and myself for recurring in-person meetings. And in another district, we have just submitted a reclassification request to help fill a need for increased leadership and resource coordination capacity. And last, this month we have celebrated National Social Work Month at a division level for the first time in many years. And this is to support morale and to formally acknowledge the contributions of staff. This has included messaging from the Family Services Management Team, certificates to each district signed by our commissioner and deputy commissioner recognizing everyone's contributions, as well as planned recognition for our staff in the Front Porch Forum and supporting staff to celebrate with donuts and coffee with other districts. I'm going to turn it over to Tyler to discuss the high-end system of care status, unless there's questions for me now.
Not seeing any questions in the room.
Thank you.
Thank you. I just want to just say that DCF is really fortunate to have you focused on this. These are 8 things that you've listed here. I know there's a longer list that you're constantly working on. We made the effort to create your position and are lucky to have you in it focused on workforce for DCF. There's so much to do, and progress is coming along. And there's still so much more to do and more to improve. We're not here to say that things are perfect, but we are definitely focused. Thank you.
Thank you.
Alma, would you? Oh, thank you. So I just want to start off by acknowledging much of what we have in these slides, Commissioner Winters touched on already. So I won't kind of belabor points that he's already made too much, but I will get into the data a little bit more specifically. So the reason the high-end system of care is so important in a conversation about the health of our workforce is that we recognize one of the primary drivers behind workforce discontent based on surveys and more has been the challenges associated with lack of resources, lack of placement resources specifically related to kids at the point of greatest crisis. We saw a dramatic escalation in the practice of alternative setting staffing that has challenges on every front, and it has the use of alternative settings has kind of moral implications for our staff because we know that there's other services, other programs we would like to apply for kids in our care. So it's been a big driver, and I think the focus on developing out our high-end system of care has in part been to support our workforce on the front lines who are trying to manage situations that have historically been impossible without an organized response from central office. So that's why there is a focus on the high-end system of care here. At the central office level, it is about supporting our districts and our workforce. And then, of course, the larger underpinning of all of this is to provide better services for kids in our care. By bringing organization and efficiency to some of these processes and by expanding our resource, specifically facility resources, kids are able to get the treatment they need when they need it more quickly. So I'll just very briefly touch on these points. After a years-long effort to expand our high-end system of care, we finally have seen that there's an easing of pressure on the workforce. The updates have been detailed in our bi-monthly Raise the Age progress reports over the past, most of the past year, and even in the years prior to, we had some not quite as frequent reporting, but we were as accurate as we could be in those reports. So if folks want to see more details, the latest report should be out within the next couple days. It's due at the end of this month. And what that is it kind of brings in all the efforts that have gone through all the reporting period. We've really summarized and built onto that report each time we submit it. So there'll be more detailed information for you in there if you're interested in taking that time. What we have developed, as Commissioner Winters spoke to, is the development of the Red Clover program. This is significant because after 4 years to the day, it was the first access to secure placement we had in the state since the closure of Woodside. And so that has made a substantial difference in and of itself. It means that we're able to address those kind of crisis needs of delinquent youth immediately and responsively, who are otherwise being held at our highest level community-based crisis stabilization program. They were having to dramatically reduce the census to support the needs of those individuals for safety's sake of everybody. And now there is a little bit of a pressure release. 4 beds is not a lot. We believe we need more than that. I think that'll be a topic for more discussion in these in months and even years to come of what is needed and why. But 4 beds makes a substantial difference in that. The commissioner mentioned the VCIN bed. What we originally saw in terms of who we were staffing in crisis environments was delinquent youth that had their safety concerns associated with their law abidance behaviors. And the next year, what we saw was a peak in youth with developmental needs. And so in particular, 23 and 20 into 24, the biggest driver of our alternative setting staffings was youth with developmental needs. So the creation of the VCIN bed, it's only 1 bed, but it is the youth at the point of highest crisis that we have a place with dedicated personnel who know how to serve them the best, and it makes a huge difference. The CATS team is an interdepartmental team that it's comprised of specially trained workforce who can supervise youth in alternative settings. The intention of the CATS team has always been to find volunteers who want to do this type of work so that we are not relying on standby workforce. Folks, right now, FSWs are all included in standby calendars, which means after hours, they might get a phone call saying, we need you to respond. And they have no choice but to go out and do as directed. This was a huge driver behind discontent when folks are being pulled from their families, pulled from their lives in order to go out and staff cases. And it wasn't so much as just kind of covering an hour or two while we figured out another solution. Some of these staffings were multiple days, weeks, even in months-long staffing. So there was a point in time, and I think this is a talking point that I have a little bit later on, but there was a point in time in 2023 at the peak where we had every single standby worker in the state of Vermont called out to be part of at least once to be part of 5 concurrent alternative setting staffings that was going on. It was a huge, huge demand on our workforce. So the CATS team was part of the response to be able to address that need and specifically address that need for youth with acute issues, safety concerns. They are trained to be able to physically intervene if necessary, and also de-escalation techniques. And then last but not least on what we have done is we have listed staffing supports contracts. We have contracts with 5 workers. TLC is the agency we utilize. They have 5 full-time staffers that we contract with them for. And that means if we have these staffing environments, we can reach out to them first. And that is their full role and full job. And that has been the single biggest driver in reducing the demand on our workforce to do alternative setting staffings. We do list a couple other projects that are still underway by the state. There's, of course, the Windham County Crisis Stabilization Program. This will be a small 2-bed program, and that program is intended to ease or to diversify our community-based crisis stabilization network. So not all the same youth are being asked to stay in the same crisis program because it's the only one available. If there's a challenge a conflict between 2 kids in our existing program, right now there's nowhere else for them to go. So the idea of having a small, flexible, nimble other program means that we can make decisions on how to spread kids out should such a need arise. That renovation is underway. It's set to be completed by June, and we have an RFP open right now to identify a provider, and some interest has been expressed in that. The psychiatric residential treatment facility is a multi-departmental project, and it is geared at bringing on 15 beds into the Brattleboro Retreat. There was a bit of a delay while we worked with Green Mountain Care Board, but at this point, things are underway, and we are back into contracting with the retreat so that we can hopefully have the PRTF up and running by the fall of this year. Green Mountain Youth Campus, of course, is a longer term project. It's set a little farther out. There's a lot of complexity involved in that, but that's also under works. Alma, could you advance this one, please?
Tyler, if I could jump in real quick on some of those
Of course.
projects and, you know, at the peak, I think of the frustration from the family service workers about a year ago. You know, a lot of those things were delayed in different ways. So we thought we were going to have Red Clover online several months before we actually could. We thought we were going to have the CATS team up and running several months before we actually did. If there were contract issues with the building, there were construction issues, there was difficulty finding a provider to run it. And then with the CATS team, it was just, there were big training, policy, negotiations over the contract, getting people the right pay, things like that. All of those things led to delays. So understandably, the workforce was saying, we're in a crisis, we need help. Things are getting delayed. So they're okay, we have to push this out another month. We have to push this out another 6 months. So the frustration really built understandably there. But we do finally have those 4 things online, you know, starting in October and December and January. You can really see the difference that that's starting to make, and believe that the staff is really starting to feel that. And the kids we serve are starting to feel that as well.
Thank you, Chris. Hopefully, this is a data point that shows the turning of the curve that we're talking about. Now, this is the number of staffings. So there's a number of ways that we call workforce out to staffings. This isn't all workforce call outs, but this means we had to staff a case in a situation. Sometimes these are short in duration, and they're in multiple different places. They're not all these days-long alternative setting staffing environments. They could happen in a hospital, in a police department, hotel room or suite. They could be within the DCF district offices. It means that right now there is a placement crisis. We don't have a place for this young person to be. Therefore, DCF needs to be putting eyes on attention to them in this moment. And you'll see this has always been something that happens. We get kids that come to us at the point of crisis. We're first introduced to them at the point of crisis, and we need to figure out what to do. But historically, it's a rare occurrence. And part of that is because the resources have been available within our flexible crisis stabilization programming. There's always a little bit of room at the inn, so to speak, so that when those situations come through, we have a place to send a young person. When all of this kind of changed due to the reasons I shared before, pandemic, staffing, programs got smaller, there all of a sudden wasn't space for kids to go. And so increasingly, we had to utilize our staff and our other resources to be supervising these kids. And you'll see right when the pandemic hits in 2020, is where it just starts to tick up, and then it skyrocketed after that. And it peaked in 2023, as I described earlier. And what we're hoping, this evidence is in 2024, that has already come down dramatically. And I think that is due to all of our efforts to expand the system of care. And I think that the pressure easing that we're hearing from workforce representatives is the data following that. I do want to take this opportunity to say alternative setting staffings are not something the department wants to be holding. They are a service of necessity. They often co-occur with the disruption of treatment or education for youth. There are environments where there is often a shifting staffing pattern around young people, so they don't have a consistent caregiver that is supervising them. There are different people coming in. They are intensive and very time consuming when it comes to coordination efforts. Early on, those coordination efforts largely sat with the district office, with the workers that were trying to manage the cases. We do know that it is an expensive solution to be able to hold those kids in that moment. So our efforts to make the process organized, make it efficient, all those efforts have dramatically improved the experience of young people in these environments. That being said, it is still not a treatment environment. It is still not the practice we want to go behind, but it is our position that if we are in this situation where we need to be caring for a kid in this situation, we need to do that in the most efficient way we can with the most care and attentiveness to the nurturing of the child. And so part of it, bringing on Lisa, who's here, you can see her right now on the screen, is that she coordinates those efforts. She helps give support to the districts in making decisions around where the appropriate staffing is, if a case is appropriate for staffing, and if it is that, who should be doing it. She has a list of contacts, whether it's the TLC workforce I mentioned, whether it's access to the CATS team, whether it's respite providers, respite foster providers. She can call on folks and help organize that and ease that pressure off the district office. And that steps me to my last slide. If you could advance us, Alma. Which just shows in 2024 how those staffings looked. So I've mentioned some of the things we have done to improve the experience of our workforce when it comes to staffing. We have a full-time position now. There has been policy and protocol developed to ensure that what we're doing is providing good care. We have a weekly high-end system of care debrief that Lisa hosts, where we invite all the people who participate in the staffings to come together, and we talk about what happened, what went well, what went poorly, or what could have gone better. Is there any new learning or information that we can help make our process more effective and efficient? And what we saw is early on when we had those debriefs, we had a heavy workforce representation in terms of the family services workers who were conducting the staffings. Very rarely now do we see any workforce that was a staffer join these debriefs. Typically, it is just the social worker who's managing the case, and we go through it, but it's kind of shifted from being we're here to be supportive and help you get through this difficult thing and hold it together, into how do we just improve upon our learning, sort of administrative almost room, which doesn't say that we aren't able to hear, to be there and to hear needs should they come up for folks, but we're seeing that FSW workforce aren't coming in with the same sort of pressures we saw a year and more ago. Of course, I spoke to the CATS team before, and there's the expansion of the respite foster care list. When Lisa started in our role, we had about 6 names of folks that we could call on to support us that. And now, I don't know the number, I think it's over 40. Lisa can share that greater detail. So we've really expanded our resources in terms of people who can be called in to be a staffer. The last point I want to make here, and I think this is to hold against that statistic I gave you before about in 2023, in July of 2023, when we had every standby worker in the state called out to do these staffings. We put our brains together and tried to remember how often we've asked standby workers to come and be staffers recently. And in the past 6 months, we could think of 2 instances where we had to call on standby workforce. And it was only for a few hours while we coordinated other efforts to get folks in place. So we're kind of, at least in this moment in time, and when it comes to calling in standby workforce to do this work, we're back to where we were back before the pandemic of calling folks in. It's not part of what we're asking of them anymore. So it is a market difference, and we think there might be still some residual kind of emotional impact over the difficult 5 years we've had. There's no 2 ways about that. It has been a tough 5 years getting to where we are now. I do think there is still in some workers who've been stalwart and sticking through it all this time. There's understandably residual emotional effect from what we've been through. But I do think the organization of our high-end system of care and work that Alma has put into addressing the workforce directly is beginning to make an impact on the sentiment of folks and how it feels to be a worker in the department. So that concludes what I have prepared. Anybody has questions? Lisa, Alma, and I would love to share.
Thank you. Very in-depth and helpful. Appreciate it. Committee, any questions or comments? I think we're good. Thank you.
Thank you. We really appreciate it.
so much.
Yeah, thank you. Thanks, Dave.